Today on Hand and Wrist TV. Playing too much golf can actually be good for your health. We'll tell you why. The secret to improving your golf game and preventing injuries on the links. And celebrities love their golf. We'll tell you what extremes they go to get their game on. That's coming up on Hand and Wrist TV.
Hi everyone, and welcome to Hand and Wrist TV. I'm Dr. John Knight. Golf is one of the world's oldest sports and most popular. In fact, it's been played on the moon. Unfortunately, being a sport that relies heavily on the hands and wrists, golf is also responsible for more hand and wrist injuries than any other sport. You might think that the more you play, the more you increase your chances of getting hurt, but the opposite is true. We tend to see more injuries in the recreational golfer who sits around on the sofa throughout the year and then hits the course again in the spring, hitting 200 golf balls and playing several rounds of golf each week. These types of injuries are from overuse. Another type of injury is from poor mechanics. Any injury from poor mechanics happens when a golfer hits the ball with a fast downward swing or whipping action as opposed to a smooth, slow swing. This can cause excessive wrist motion in the left hand in the right-handed golfer. Additionally, too strong of a grip, excessive grip, or poor equipment can also cause injuries. The third type of injury we see in golfers is from traumatic injuries. Now, traumatic injuries occur when a golfer swings hard through the rough, taking a large divot, or even striking a rock. These can cause a twisting injury to the wrist, which can lead to significant ligament damage or even a fracture. This kind of injury can keep you out of the game for some time. People love golf, and celebrities are no exception. Academy Award-nominated actor Samuel L. Jackson loves it so much it's rumored that his film contracts include a clause that allows him to play twice a week while filming. Amazing. Coming up, the most common golf injuries and how to avoid them. Now, most wrist injuries involve the non-dominant left hand or leading hand in right-handed golfers. The most common injuries first is de Quervain's tendonitis, which is where the tendon goes along the radial or the thumb side of the wrist, and from repetitive use, we see this called mommy thumb and mothers that are nursing, people who are using the BlackBerry too much. This can lead to a very painful inflammation. The next condition is called Metacarpal Boss, and this is at the base of the metacarpals here on the back of the wrist where the tendons come in, and you can get little bone spurs that form in this area, leading to a very painful tendonitis that causes extreme pain when playing golf. TFC tears or ligament tears in the wrist. This is a ligament, this is a cartilage similar to the cartilage in the knee called the triangular fiber cartilage, or as we'll call it, TFC. This occurs from a violent twisting motion when you hit a forceful shot, hitting too much of a divot or striking a rock. Hamate fractures are more of the violent injuries of golf where you take a deep divot striking the palm. But what happens is in this area, you get at the base of the palm, you get a very painful area that hurts to push off. This shows a CAT scan right here with the arrow pointing that shows actually a break in the bone. Again, very, very disabling injury. Most injuries occur from overuse or improper technique and can usually be taken care of with simple conservative treatment. If you get a wrist injury and start to see some swelling, immediately apply ice for about 20 minutes and elevate the arm. Now, NSAIDs or Advil or Aleve, for example, and a brace can also be helpful. If you're still hurting after a few days, as with any injury, you should talk with a specialist. It may well be that you need x-rays or even an MRI. People with a simple tendonitis often find a cortisone shot is helpful in reducing inflammation. Therapy may also be helpful. If conservative treatments don't do the trick, surgery unfortunately sometimes is necessary. This shows that triangular cartilage I was talking about on the outside of the wrist. This shows us through two tiny 2mm incisions on the back of the wrist. We put in a scope that broadcasts to a monitor such as this, and at the same time we put a little, it looks like a roto-rooter we're putting in the wrist, as you see here, like a vacuum cleaner, simply trimming out the tear. After about 6 weeks, you can get back to your full golf game. If you do have surgery, even though you're anxious to get back in the game, you need to take it very slow. Go out and hit several light resistance shots to start and take it one day at a time. Coming up, how to prevent golf injuries from happening in the first place. Now that you have seen what injuries can happen while playing golf, let's look at how to avoid them altogether. We talk with Los Angeles golf pro Stephen Viltz about the importance of proper hand alignment.
This is the most important thing in a golf swing is the grip. So we got to get that right. So the main thing we're going to do is go through 3 grips. The grip is technically in the fingers, short thumb, 5-finger grip for small-handed people, junior golfers, ladies, and seniors. That's one of the grips. The second grip is for moderate side hands, an interlock grip where the hands is working as one as close as possible. The club is in the fingers, sealed, everything is there. That's the second part of the grip. The third grip is the overlap grip. This is for people with large hands, the moderate to large hands, to real large hands. The overlap grip where the right hand is in the pinky finger is gone into the left hand. The grip is the most important thing. So once we learn to grip the club, we will not hurt ourselves in hitting the golf ball.
Some great advice. Now, your clubs can also make a difference when it comes to protecting your hands and wrists. Use lighter graphite clubs instead of steel. Make sure your club fits properly, getting fatter grips if you need them. There are also some things you can do before you hit the course. Spend some time in the gym, strengthening your core muscles. This will increase the power of your torso when you're swinging a club and will also reduce the stress across your wrists. And as in any sport, warm up and stretch before you play. I hope this show improves your chances of staying injury-free on the links. As far as improving your golf game, well, that's a different show. Thanks for joining us. I'm Dr. John Knight, taking good care of your hands and wrists with every episode of Hand and Wrist TV. See you next time.